Let's see the treatment of acute attack of gout. In acute gout, we use NSAIDs, that is non-steroidal anti-inflammatory drug, or colchicine and glucocorticoids. So NSAIDs. To relieve an acute attack, NSAIDs like naproxen, endomethacin, piroxicam, diclofenac, aceclofenac, etoricoxib are used. They are better tolerated than colchicine. Why are NSAIDs preferred? Because they are better tolerated than colchicine. NSAIDs like naproxen, endomethacin, diclofenac, aceclofenac, piroxicam, and etoricoxib are used in the treatment of acute gout. Let's see about colchicine. Colchicine is an alkaloid. It is neither an analgesic nor uricosuric agent. Although it relieves pain in acute attack of gout, it is not an analgesic and not even a uricosuric agent. But in acute attack of gout, it relieves the pain. Deposition of urate crystal in the joint, chemofactors will be produced. When urate crystals are deposited in the joint, chemotactic factors are produced, जिसके कारण neutrophils migrate to the joint and release factor which contribute to inflammation. So this happens in acute gout. In the joint, urate crystals are deposited, chemofactors are produced, the neutrophils migrate. Okay, they migrate and then release factors which will contribute to inflammation. Okay. तो यूरेट क्रिस्टल के डिपोजिशन के कारण कीमोटैक्टिक फैक्टर्स आर प्रोड्यूस्ड एंड देन न्यूट्रोफिल्स माइग्रेट. Colchicine prevents the release of chemotactic factors and inhibits the mechanism of neutrophils to the affected area. So this is the mechanism of action. They prevent the release of chemotactic factors and also inhibit the migration of neutrophils. क्या कीमोटैक्टिक फैक्टर के रिलीज को प्रिवेंट करता है और न्यूट्रोफिल्स के माइग्रेशन को इनहिबिट करता है. इट इज़ एडमिनिस्टर्ड ईदर ओरली और इंट्रावीनसली. क्या कॉल्चिसिन को या तो ओरली देते हैं या इंट्रावीनसली. सो रूट ऑफ एडमिनिस्ट्रेशन कैन बी ओरल और इंट्रावीनस. इट इज़ रैपिड एक्टिंग बट पुअरली टॉलरेटेड. Rapidly acting but poorly tolerated, so this is the disadvantage. They side effects like nausea, vomiting, diarrhea, abdominal pain. Chronic use can lead to myopathy, alopecia, aplastic anemia, and agranulocytosis. So these are the adverse effects of colchicine. Okay, nausea, vomiting, diarrhea, and abdominal pain. GIT symptoms like nausea, vomiting, diarrhea, and abdominal pain. And chronic use can lead to myopathy, alopecia, aplastic anemia, and agranulocytosis. Chronic use के कारण myopathy, agranulocytosis, alopecia, and aplastic anemia. ठीक है. साइड इफेक्ट्स nausea, vomiting, diarrhea और abdominal pain. Chronic use के कारण there are 3 A's: aplastic anemia, alopecia, and agranulocytosis and myopathy. Chronic use causes myopathy, alopecia, aplastic anemia, and agranulocytosis. Then glucocorticoids. Glucocorticoids are effective and produce rapid response and are reserved for cases not responding to NSAIDs and colchicine. तो ग्लूकोकॉर्टिकोस्टेरॉइड्स इफ़ेक्टिव होते हैं और रैपिड भी होते हैं, बट ये सिर्फ उन केसेस में यूज़ होते हैं विच आर रेसिस्टेंट टू NSAIDs and colchicine, which are not responding to NSAIDs and colchicine. उसमें ग्लूकोकॉर्टिकोइड्स यूज़ करते हैं. Like prednisolone and methylprednisolone, they are used systematically in gout. If a single joint is affected, then intra-articular triamcinolone is effective. अगर सिर्फ एक single joint affected है, then intra-articular triamcinolone is effective. ग्लूकोकॉर्टिकोइड्स जो है वो उन केसेस में यूज़ होते हैं विच आर नॉट रिस्पॉन्डिंग टू NSAIDs एंड colchicine. ठीक है, जैसे कि प्रेडनिसोलॉन और मिथाइल प्रेडनिसोलॉन, दे आर यूज्ड systematically in gout. And if only one joint is affected, then intra-articular triamcinolone is effective. Okay, this is the route of administration. Intra-articular triamcinolone is effective if only a single joint is affected.